Okay, so we are here with my friend Santi, who I met last year at the Physicians Coaching Summit, and I'm super excited for you guys to get to know her like I have. She's an amazing person. So, Santi, would you like to go ahead and tell us a little bit about what you do?
Yeah, so my name is Santi Tanikella. I am a pediatrician and I also practice pediatric integrative medicine. And more recently, I opened a business for life coaching because I wanted to help people to up-level themselves and to overcome obstacles in their day-to-day life. I also wanted to be able to help them to have the tools to transform their lives. I'm so excited to be here with all of you today.
Yeah, that's so. I remember when I met you, I love how you have this really great balance of obviously traditional medicine, being a pediatrician and a physician like myself, but you really blend that so well with integrative medicine and natural approaches and things like that, which I think is often very much lacking in modern medicine.
Thank
Um,
you.
would you like to share a little bit about how you decided to make that transition? Were there any sort of specific events that happened or experiences that led you to this path?
Medical school.
Yeah. Tell us more.
That was, I mean, so really specifically what had happened was I started my first year of medical school and I had these, you know, images of grandeur that I was going to become all knowing about all things wellness and human, like I wanted to know all about how the human worked. And for me, what ended up happening was we, really learned this biomechanical model of the human being. And I don't I didn't feel like I was getting what I needed. Like I really wanted to be able to understand what motivated a human to be able to make the decisions that they make, whether it's towards wellness or away from wellness. And those weren't tools that we discussed in medical school. And it got to a point, and I think a lot of physicians can relate to this, that during our training it's not a period of wellness at all. It's like self-deprecation and like emotional starvation. Like I don't know how else to put it. It's just I never felt well during medical school, and so perhaps part of that was me wanting that for myself, and then wanting to hone those skills to be able to give that to my patients as I progress through the training process.
Yeah, that totally makes sense. I agree. It's one of the least healthy times of our lives, I think, as doctors, is when we're going through med school and then residency too. Um, so so you kind of went through med school and you were kind of exploring some of these tools around that time for your own wellness.
Yeah, yeah. So it started out with, it actually started a little bit earlier than that. So kind of during my pre-med years, I started dabbling with Ayurvedic medicine and learning about it. I thought it was really interesting. So for those of you who are not familiar with Ayurvedic medicine, it is the traditional form of medicine practiced in India. Um, and it dates back 5,000 years. So there's a lot of history behind it. And what's interesting about it is that the foundation is actually wellness. And it's a little bit different than what we do here in conventional allopathic, osteopathic medicine, where the primary focus is actually on how do we save lives, right? Like we're really
Mm.
good at acute care and, managing heart attacks and intubating and, rescuing, truly rescuing people. And I think that that's brilliant and amazing and beautiful. And I'm so grateful for it. And I think Ayurvedic medicine for me offered that very fundamental layer where, well, you have this life. Now, how do you live it? And how do you live it well? How do you thrive? We didn't
Mm.
have that in allopathic medicine. So, you know, pre-med, I started reading books about it. And then it became abundantly clear for me during the first year of medical school, like, oh, this part's lacking. I really thought I was going to learn about it, and I wasn't. And maybe sometime during the next 3 years, I will learn about it. And it came like in little bits and pieces, right, here and there. But really, what changed for me was that between first and second year of medical school, I actually went through a period of burnout. And I remember like March of my first year being like, I need to leave. Like, I need to leave now. And So I did, and I went to the farthest place that I could, and I went to India and I did a
Love it.
rotation there. And I learned more about hands-on Ayurvedic medicine and naturopathy and homeopathy, and Reiki, which is a form of energy medicine. And it was really interesting what all of them were saying, which is there's this piece of human suffering that needs to be addressed and is part of the illness. It is not in our, medical upbringing, we looked at human suffering as part of the problem, like it was a
Mhm.
pesky fly that we needed to swat away and really focus on the biomedical part. But in these traditions, the human suffering was something that was addressed alongside the actual medical problem.
Mhm. Oh, that's
So
so interesting. Yeah, it's interesting coming from like the coaching perspective too, where you start, I came into coaching later after being in the medical world for a long time. And it's so true in medicine. And I think in a lot of our society here, especially in the US, right? It's like suffering is the problem and it should all be eliminated and it all should be gone. It should sort of be pushed off to the side, right? And then the coaching perspective, which is a little bit more holistic and, kind of that perspective that suffering is part of the process, whether we like it or not, and how do we sort of engage with it and cope with it more effectively. So
yeah,
that's really,
exactly.
really wise. Really, it's cool that you experienced that so early in your medical career too. So, so then you did two fellowships, right? Is that correct? Pediatrics and integrative medicine,
So
or
for
residencies? Yeah,
residency, I did
yeah.
pediatrics.
Hmm.
And then I went on to go into private practice for a few years and
Hmm.
then went into academic medicine.
Hmm.
And what ended up happening was during the time that I had been in academic medicine, I was asked to create a clinic dedicated to pediatric integrative medicine.
Mm, okay.
And so at that time, the process of um, certifying for it was a little different than it is now. You were
Mhm.
actually, depending on how much you had already practiced and how much education you'd already received, you could sit for the board. So I sat for the boards and got my board certification. And then I was asked to open the clinic, and I was like, maybe I should go to fellowship. So I went to
Yeah,
fellowship, I opened the clinic, and it was a beautiful, beautiful learning process for me.
yeah.
And I met a lot of wonderful human beings, families, patients that have touched my heart. It was a clinic in which, and it was interesting, and don't take offense to this, but it ended up becoming this place where patients would go from their primary care provider to specialist, not getting the answers that they were seeking, the suffering really increasing, and both the specialists and the families were scratching their heads wondering like, well, where do we go from here? And
Mhm.
that's usually when they were referred to me,
Mhm.
is we don't know what else we can do to help to alleviate some of these problems. Can you step in? What do you think? So most of what I saw was patients who had amplified musculoskeletal pain and were really starting to have a debilitating level of illness where they could no longer go to school. They couldn't engage in sports the way they used to. Maybe they were having episodes where they were passing out. They were starting to sink into anxiety and depression and were afraid to leave the house because they were worried, well, what if something happens? What if I'm in too much pain, or what if I pass out again? Really,
Mhm.
so the quality of life was really dramatically dropping.
Mhm.
So that's just one example of the type of patients that I saw. I also saw a lot of patients who had anxiety and depression or had a history of child abuse. I had a handful of patients that were on the autism spectrum. And I also had a couple of patients that were completely nonverbal due to developmental delays. And so
Mhm.
that was an interesting process to be able to reach them in this sort of space. Um, and I have to say, I I like many others can be my own greatest skeptic. And
Mhm.
so, right, like
Yeah.
it's kind of like, well, we'll try it and we'll see what happens, but I'm
Yeah.
cautiously optimistic.
Mhm.
But in these cases, like really what I saw, blew my mind. Like I was
Really.
able to reach even those kids that were nonverbal. And so that was really rewarding to be able to see.
Yeah, I mean, I think as a parent who had, my listeners know I have, my family has a lot of anxiety and ADHD and autism, things like that. So as a parent who has been through the process of trying to help my kids, I can definitely relate to that feeling of, how amazing it is when you finally find something that gives you even a little bit of a step in the right direction, right? Because it feels like you're kind of just spinning sometimes and it's taking over your life and you're grasping for things. So I can imagine that for those parents, coming to you and seeing that bit of progress was probably just incredible for them, like life changing, really. I can
And
definitely,
some of them
I saw
have
that.
said that.
Yeah.
Yeah, some of them have said that because it really, one in particular that I can think of has a genetic syndrome that causes him to be very developmentally delayed. Um, and he had multiple other chronic medical illnesses that caused him to need procedure after procedure after procedure. And so there was a lot of anxiety for him whenever he had to go to the hospital or to a doctor's office. So for me to be able to work with him so that he's not afraid of doctors anymore, that he's able to actually breathe through some of the procedures without needing sedation anymore.
Yeah.
That is stupendous. And I think it,
Yeah.
it it also surprised other people like his surgeons and the nurses that worked with him on the inpatient side. That was
Yeah.
that for me, I think was a turning point because it showed me how much we could actually do with our minds and not even we're just not taking we're not taking advantage of the potential here, you know.
Totally. Well, and I want to ask you some specific scenarios because I'm sure people are like, okay, like what are these things that she's doing? So we'll give everyone, a lot of really good insight into what it is that you exactly are doing and things like that. But I think it's so interesting how you pointed out that you can be your own, biggest skeptic and sometimes you're cautiously optimistic. And one of the things I notice is that in our society, there's kind of like, there's the traditional medicine people, which we tend to be very skeptical and we like, okay, here's the chance that this will work and the chance that it won't. And, we're very like that kind of cautious mindset, which, as you mentioned, has a very important place. And this is not to downplay that. And then I noticed that sometimes when people don't feel that they're getting what they need there, then they kind of go the other direction to someone who's very much outside of traditional medicine. And there's a lot less of this need to couch, I've had friends who go and they're like, well, I saw this, non-medical doctor and they said 100% guarantee if you do this and this with your diet, all your symptoms will go away. And I noticed that people really respond to that and they really like that feeling. And they do often get some pretty good results from that. And so what I think is cool about what you're doing, and I think there's not a lot of people in this space, is kind of you have kind of one foot in both, right? So you're not going out there and saying, I will, I promise you 100%, like, just use your mind and everything will get better, right?
Yeah.
But you also are like you're kind of bringing that piece in that we are missing of using your mind as you're also, being cautiously optimistic and working through all the other things. And I wanted to point that out to people because I do think there I wish there were more people who were able to incorporate both because I think you can I'm sure you get amazing results being able to do that. And I guess it feels like I think of people who are extremely skeptical, like hi podcast editor husband, right? Who I had some supplement I bought and he was like, this literally says on the box that it's like homeopathic, you are a medical doctor. Like he was teasing me, right? And I was like, I don't know if it keeps my colds from coming back, like I'll take it. But I think that for people like that, someone like you who has a very measured perspective is really a good fit, right? Because it's not going to feel so far off into the woo that was kind of a long comment, but I just wanted to highlight that because I think that's really amazing.
Right. And I think that kind of brings home a big point here is, there is a lot of belief that integrative medicine, which used to be called complementary and alternative medicine, is considered woo woo, and it's really not anymore. It's really becoming part of mainstream medicine, and part of the reason why is because there's now an evidence base that is really, it's burgeoning. So, when I think of what integrative medicine is, it pulls together the best of allopathic and osteopathic medicine and combines it along with complementary modalities. And I'm highlighting complementary here, not alternative. Complementary modalities. You are using them along with conventional medicine in an evidence-based, patient-centered way.
Yeah.
so that we are optimizing healthcare here. Like that is the goal. We want our patients to have the best outcomes possible based on the circumstances that we have in front of us. And so with that in mind, we're now the egos drop away, right? Like we put aside the ego of the physician, we put aside the ego of the parent, and we're really looking at the patient, right? Like what are their needs? And I think the other piece that's really important is that it's collaborative along with the family, right? Like we can say all the things we want and offer all the things we want and say, you should do this, 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 and this. And the parents might just be like, great, thanks, bye.
Right.
Right?
Yeah.
So really like you want to be able to understand the parents as well as the child, understand the culture of the family, the beliefs surrounding the illness. You want to be able to debunk myths about the illness. And you want to be able to provide them with options so that they're able to make educated decisions, right? This is true collaboration here. So it's integrative on the medical level, and it's also integrative when it comes to the physician and the parent coming together in a holistic way for this child.
Right. Oh, that's such a good point. And I think that's all what we theoretically want to strive for. But I think in traditional medicine, a lot of factors make it more difficult to do that, just some of the mindset and the timing. And I think that kind of brings in the training you've also done as a coach, because I know a big thing that coaching certification and coaching other people has helped me with is that idea of like, I can't just tell someone this is the answer, you have to do it. It's really learning to collaborate and be open, and that doesn't mean that you're not going to be giving someone something that's very helpful, right, from your own expertise. But it's so I know you've also done a lot of coaching work, and I think that it's just like you have the trifecta, right? You've got the traditional medicine, the integrative medicine, and then also the coaching perspective, which so cool. So, but I want to make sure we have time to talk about some specifics. I was even thinking as you're giving examples of those kids. So, if it's okay with you, this maybe the easiest way to do it would be I could give some examples of things that I've experienced or some of my clients have with our kids,
Sure.
and then you can kind of just give me some of your thoughts about how you might approach that. And so as you were talking about that child who had a hard time with the medical procedures and things like that, I was actually thinking of my kids. So there's a lot of similar types of anxiety in my children. So for those that don't know, my kids are 7 and 9, and they're wonderful, and they just both have I think anxiety is the easiest way to summarize it. So um, right now, our biggest remaining issue is my daughter's anxiety around taking her medication. So it's ironic, it's actually an anxiety medication, which has been transformative for her. But she still, after it's been like a couple years, she has so much panic every day about her medicine. It takes over our whole family's life. So kind of thinking about someone like her or like this child you mentioned, what are some of the strategies that you might include?
I need to dig a little bit
Oh,
deeper here. What exactly is it about the medication that puts her in a place of panic?
yeah, it's a little bit hard to figure. She seems to kind of every day, even though she's been taking it for a year, and it's a tiny pill, and she can swallow it. And we put it into yogurt, and she swallows it that way. That seems to be the easiest way. But when it comes time to do it, she is just immediately like, I can't do it, and she'll start saying things like, um, I can't. What if I can't do it? What if I'm just a person who can't take pills? What if I'm never able to swallow my pill? What if it doesn't go down right? Like, and we're obviously we're like, well, each day you get better, and each day you've done it, and think of all the times you've done it. But it's almost like her brain just wants to keep going down this pathway of like, it's like the anxiety is almost like a familiar pathway to go down, right? And I will say the other thing that may be helpful to know is like distraction uh, helps her quite a bit. So, for example, if we put on like a video, she likes art, so we'll put on a video of a friend of mine who does time lapses of her drawing, or something like that that makes her happy and distracted, and then often we can do it. But otherwise, if that's not there, she'll put it in her mouth, and she wants all the attention, usually from her dad, who's her like number one safest person. So she wants him to stand there, and she wants him to like count down on his fingers and talk her through it. And so I don't know if that helps. She wants, it's just more like a panic about the idea of swallowing it almost.
Yeah. Yeah, so there are actually psychologists who are trained to help with pill swallowing. It's a very interesting, it's an interesting phobia actually.
Mhm.
And your point is exactly that. She can do it. There's just something about it that, that makes
Yeah.
it hard for her. But one thing is, and you said she was 7, right?
Hmm.
So maybe having a calendar where she can see, like, each day on the calendar, you're like, swallowed, swallowed, swallowed. So now she
Hmm.
has this huge calendar of days in which she's actually swallowed. Like the evidence is right there staring her in the face, right? That might be something where just having that sort of visual might provide her with a little bit of courage
Hmm.
um, to overcome it. You know, the other piece is, being able to kind of understand, like, is there a way that we could are there specific foods that she has the same phobia with, like things that have little pieces to them? Does she get fearful of M&Ms, right? Like you can get the M&M minis and try to help her practice with those so
Hmm.
that she's got that exposure multiple times. I mean, it seems like she's already had the exposure over a long period of time.
Hmm.
But hopefully actually having the visual might be more helpful. I think as adults, we can conceptualize the fact that, oh yeah, I've done this every day for a year, I can do this. But for a
Hmm.
child, that's a little bit more esoteric to them.
Hmm.
So that's one piece of advice.
Yeah,
Yeah.
that's a really good idea. I do think we sometimes forget as adults that kids need that visual reminder. I think we forget, like we all have our phones and stuff and we're like, oh, looking at this and tracking this, but they often don't have that. So I like that a lot. And I think kind of related to that, it may be more sort of generally applicable for people if you have a kid with anxiety, which I think since COVID, as I understand, has been a lot more common,
Yeah.
both in grade school age kids like mine, but also in teenagers. But I know for me, it sometimes seems like with my kids, the anxiety is more of, it's not, it might come out regarding the pill in that moment, but if it wasn't the pill, it might be something else because it's almost like the anxiety is just underlying everything and it's hard to pinpoint this specific trigger sometimes. So do you have thoughts about how you might start approaching that with some of your clients?
Yeah. I mean, one of the things that I've noticed too is it could be anxiety about, let's just take an example here, like anxiety about somebody at school, like a classmate, right? And yet then it infiltrates the rest of their lives, right? It can affect their meal times, it can affect their bedtime routines, it can affect their relationships with their siblings or their parents, right? It's not just localized to that one place, unfortunately. And so one of the pieces of advice that I give my parents is that if you're going to create a regular routine where you're teaching something like mindfulness, don't wait for things to get bad before you start it. I would actually recommend, and I would do 1 minute for age of child. So let's say it's, in your case, it's a 7-year-old, so 7 minutes of meditation. And if you needed to start even slower, set the bar really low, just do like 2 or 3 minutes and just start with something simple like deep breathing, deep, slow breathing. Um, I would actually tell parents to do it like 2, 3, 4 times a day. So maybe before school, after school, bedtime, right? Routine times of the day, usually 2 minutes. Well, in my case, 2 minutes is a lot of an ask in first thing in the morning with my kids.
Right,
But
yeah.
but for those of you who have less crazy mornings than me, 2 minutes in
Hmm.
the morning usually isn't a huge ask.
Hmm.
But you could even do it in the car ride on the way to school, or you can, talk about
Hmm.
like, okay, you're going on the school bus. This is your time to do your deep breathing. So
Hmm.
basically, what you're doing is you're starting to build that mental circuitry up where this tool now becomes a stronger and stronger tool in their toolbox so that when they need to count on it, it actually works.
Hmm.
Yeah. Like,
Yeah. Go ahead.
yeah. So, and that applies to a lot of the different mind body practices, whether it's mindfulness based stress reduction, whether it's just deep, slow breathing, whether it's biofeedback, whether it's imagery, guided imagery. All of these kind of work in a similar way in that they're really changing the way the brain thinks and feels about something.
Hmm.
And you're just like learning your ABCs, that repetition is going to make it easier and easier for that child to remember.
Hmm. And then if you have a kid who's, so my daughter is quite, she's very physically active. And so she has a difficult time sometimes when I do, like I'll play a guided meditation or read a meditation card that we have. She sometimes has a hard time even sitting still for that. Um, do you have, first of all, I guess the question I would have is, do you think that something guided would, with more imagery, would work a little better for her than just breathing on her own? And then secondly, like, is that a problem if she's like sometimes she's literally like moving all around while we're trying to do it?
So maybe yoga might be a better fit.
Okay. Yeah.
Yeah. And I'll kind of give you an example. Like for me, when I was in medical school, that's when I started learning about mindfulness-based stress reduction, or MBSR.
Mhm.
And I couldn't sit still. And I like really was down on myself about it. Like, why can't I sit still? This has got to be the easiest skill in the world. I literally cannot just sit and breathe. And then once I finally did start sitting and breathing, um, the intrusive thoughts would start, like, I really ought to be studying, you're wasting your time, you're never going to be good at this. Oh my gosh, it made me anxious,
Mhm.
ironically. Right.
Mhm.
So like I just kind of want to put out there is, you want to get to know yourself, and that will help you to kind of pick a modality that works well for you, or a few different modalities. And those modalities may change on the day, it may change on the circumstance. Like, right, like you just want to know what's going to actually meet your needs. So trying everything out and getting to know these modalities a little bit is what's going to help you get there, so that you can pick and choose based on your needs at that moment in time.
Mhm.
For someone like your daughter, like yoga, and same for me, yoga at that period of time in my life, like I needed to move,
Mhm.
right? And that actually brought me peace. So, taking a step back and being like, okay, let's pivot, let's try something like gentle stretching and pair our breathing along with it. you know Guided imagery, I think, is also something that's pretty nice for some people who have difficulty trying to empty their mind. Guided imagery gives your mind something to hang on to and process. And it's the content of the guided imagery that helps to promote relaxation and promote feelings of well-being. We can even use guided imagery to help empower individuals. So, you know almost visualizing an experience like taking a test, where there might be some nervousness or test taking
Mhm.
anxiety, right? Like you're rehearsing yourself taking a test in your mind's eye, and noticing yourself breathing slower and calming down, and the shoulders are coming down and your muscles are relaxing. And on the count of three, we're going to start our test, right? So you can kind of imagine how them practicing that in a relaxed space could make them more easily transfer that skill to a school setting.
Mhm. Yeah, so like rehearsing it ahead of time kind of thing.
Mhm.
Yeah. And is that like if you're working with a client, is that the sort of thing where you might work with them on that in a session to prepare them and then they could practice it at home? Is that one of the things that you do? Okay.
Yeah,
Yeah.
yeah, actually. So in my coaching business, I do also provide information and teaching on mindfulness-based stress reduction practices, guided imagery. Essentially, depending on what the client needs, we can actually record on Zoom, and they can take that with them wherever they want to take it and play it whenever they need it. And after after a few times of listening, they're going to be able to really adopt that and remember some of the things that they learned. So now they've created the skill to be able to help themselves,
Mhm.
no longer need the videos or the audios to be able to do that.
Yeah, that's so cool. I love that. I love that. I never even thought about that, but yeah, you could record and have it with you. And you mentioned biofeedback, so I'm very curious about this because I don't think I ever heard of this before. You've mentioned it. So can you give me an example of where that would come into play?
Yeah, so biofeedback has had some pretty good evidence when it comes to helping to reduce anxiety symptoms, symptoms of depression. It can also help children and teens who have issues with chronic illness or chronic pain. It can help to improve quality of life with those.
Hmm.
So to kind of bring it in, like if you are in the healthcare setting and you have a pulse oximeter on your finger, right? That
Hmm.
is like your most basic form of biofeedback. A blood pressure monitor is also a form of biofeedback. Because if you, let's say, have a child or have an adult who's really stressed out, right, that blood pressure goes way up. And if you can sit with them for a few minutes, maybe hold their hand or put your hand on their shoulder and guide them through deep, slow breathing, bring the stress levels down a little bit. We're shifting from sympathetic to parasympathetic now. And you re-record the, pulse and the blood pressure, most likely those have come back down into a more normal range.
Mm-hmm.
Right. So that's with very minimal, like you're not using a medication in that moment to be able to do that. Like it's something that you can use right in the moment. Now, what I'm trained in is what's called heart rate variability biofeedback. So for those of you who are interested in learning more about this, you can visit heartmath.com.
Okay.
But basically you can put a little sensor on your ear and it will record pulse and heart rate variability. So like the beat to beat variation. And without going into too much detail, the goal is to be able to learn breathing exercises and mindfulness exercises that can help shift you from sympathetic into parasympathetic. And the biofeedback provides you with a visual meter of what's happening in your body in real time so that you know if it's working or not. That's super cool. So like when
Yeah.
I think back to my early med school years and I was trying to learn mindfulness-based stress reduction, I was like, am I even doing this right? I have no way of knowing.
Mm-hmm.
And excuse me, I don't think I really want to be that person that goes into a mountain in the Himalayas to find out, right? Like
Yeah.
years from now. Now,
Mm-hmm.
in a nutshell, this has actually jump started my practice because within the first visit, patients were able to see like, oh, that's how we do it. Okay, that's not that hard. I can do that.
Mm-hmm.
And so they're
Yeah.
able to take these skills home. So, in that interim, I'm able to give them, you know, mental exercises that they can do to help improve their self-image or feelings of well-being, and they run with it.
That's so cool. And I think it's such a like I think of people like my son and my husband who they love like monitors and tech and seeing something tangible like that, right? Any like for my son, it's like if it's on a screen or it's on like it's like a tech thing, he's always more interested. And so I think for someone like that, that would be really powerful. Um, it would make it feel tangible and real to them, I think.
Absolutely.
Yeah.
That's one of the things that I like about it too, is that it makes it fun. So actually if you go onto heartmath.com, they actually sell the biofeedback machine and the application that goes with it. And the application actually has games for kids.
Oh, that's so
It's
cool.
so cool. And if we have time, we can talk a little bit about my son's YouTube channel. He actually demonstrates how to use biofeedback in one of the games in there.
Oh, that's so cool. Yeah, we will definitely put a link to your son's YouTube channel because I think for my kid, that's another thing for my kids is if something's on YouTube and another kid is doing it and then gamifying it, like these are all the things that get them excited and interested. So, and we will, but tell me again what the name of your son's, by the way, guys, we'll put all the links in the show notes, but just so people know the name of his channel.
Yeah, it's called Ben's Zen Kids Corner.
Okay, and that is on YouTube. Yeah.
Mhm.
Okay. So, and I seriously love the idea of gamifying it. That's how my son does everything in life. So I'm like, I'm definitely gonna be checking that out.
It just makes it more
Yeah.
tenable for them, right?
Oh,
Like
totally.
kids play and they learn through play so naturally, right? Like this is a great way to be able to introduce a new topic and help them learn a new skill in a way that's not hard. We can get the
Totally.
buy-in pretty easily.
Oh yeah, no, my son, it's funny how I don't know if all kids are like this or just, but my son in particular is like, if there's a way to like record a score and like improve on that, or even if it's like completely not a competition. I think I went to a conference last week and I got a little thing that said second time attendee, right? And some people had more. And my son happened to see me with my badge on and he was like, did anyone beat you? Is it better to have like, and I said, someone was an eighth time attendee. And he's like, wow, did she get like a special prize? Like my kids are they're like, if you go
Oh,
again, you get third time. And like, they're very, like, I just noticed, like, even that has like no relevance to him at all. He's very interested in like the sort of racking up the numbers concept, right? And so I feel
yeah.
like this is again where he could be like, oh, I got the number to here, right? And he could really like get excited about that. So
Yeah. I mean, and it just brings home the point of like kids do want to engage in things that improve themselves, right? Like
mhm.
they actually they want to know that they can do it. And once they have achieved it once, they know that they can do it again and again and again, which is really
Hmm.
cool.
Totally. And as you were talking, I was thinking too, my son and I have bonded over this. Like we really just, we're always looking for like something that feels fun, right? And I think it's partly like all this like, neurodiverse wiring where we're just like looking for that dopamine hit, from our ADHD or whatever. But it's true that sometimes dealing with our emotions doesn't, it feels like work, right? It's like sit down and
Mhm.
do a workbook or, but I like the idea that this brings in that fun aspect for kids. So,
Speaking of games, I just want to put in a plug for this. I found this game called Playing CBT,
okay.
which is really interesting because it ties together cognitive behavioral therapy with positive coaching and positive psychology, right?
Hmm.
And right, beautifully coaching ties in really nicely with that. But it provides like pictures, and you don't have to play the game as the instructions say, but it provides pictures of actions and emotions and things like that. And I just think it's such a great way for kids to understand that when they're going through something, there are multiple choices about how you want to think of the situation, what you're going to feel about the situation, right? They can actually conceptualize what the actions moving forward might end up being. And it's perfect. It ties it all together in a fun way so that kids can really almost achieve emotional freedom in a way, right? Like
Yeah.
I have a choice. I don't have to feel terrible that this boy doesn't like me,
Hmm.
like I don't have to feel less than when I get an 80 on an exam,
Hmm.
right?
Yeah, that's so cool. I'm taking notes as you're talking because this is like all like my family needs all the things. So I love these tips. And I could ask you a million questions about my kids, but I did want before before I ask another one, I don't have teenagers yet, but I know a lot of my clients have teenagers, and I know that some of these issues you're mentioning, like anxiety and feelings of poor self-worth, and even pretty severe depression, are pretty common, becoming more common in teens.
Yeah.
So I was curious if you have thoughts about how you might approach things with that age group. I'm assuming it might be a little different.
Yeah, for that age group, usually there's one or more sources that plays a part. So, I'll take some of my most difficult situations, which is child abuse. Those kids have grown up with such a difficult life situation that the hardwiring for emotions is just kind of the wiring is a little bit different. And the stress, I mean, even the littlest things cause stress, right? Like if a person looks at them the wrong way, they immediately perceive that to be disapproval.
Mhm.
um so being able to bring awareness around specific um specific incidents,
Mhm.
uh, that by itself can start to undo that hardwiring so that they now can recreate better coping mechanisms to navigate future situations. So, giving an example, like I had a patient who had a history of abuse as a child, and if I looked at her the wrong way, right? Literally just looking at her like the way I'm looking at you,
Mhm.
she thought that she did something wrong. And I was like, but I'm just looking at you.
Yeah.
and, and I think it was, it dawned on me that like she was not used to, the only time that somebody looked at her was to scold her,
Oh, yeah.
right? Like that's a sort of situation that some of these kids are in. And being able to pull back and say, actually, this is actually a normal human interaction. Like I'm looking at you and there's a difference. I'm looking at you with feelings of care, with the want to help you. I'm looking at you to be able to see what your response is, right? Like this is a normal social human interaction. And being able to bring it down to that level and pull the emotion from it,
Mhm.
um, is super helpful. So, it's not just, I don't want to say that like this. Zoloft can help, right? It takes the edge off. But if you have underlying issues, you also have to work with the underlying issues to be able to find a place of peace.
Hmm.
So, using another example, that kid that has amplified musculoskeletal pain and is afraid to go to school, right? We can use mindfulness-based stress reduction techniques and biofeedback techniques and hypnosis and guided imagery to help with stress reduction, to help improve self-image, to help them feel like they can cope better and to give them a little bit more energy. But when it comes to actual interactions or perceived obstacles, well, I don't think I could sit through an 8-hour school day,
Hmm.
right?
Hmm.
Well, tell me what the evidence is for that. What makes you think you can't sit through? What are some ways in which you were able to sit through that?
Hmm.
Do you think you can do that again? Why do you think you can't do it? Right? Like we're really
Yeah.
digging deep and trying to answer each of the questions, right?
Hmm.
Um, you know, and as we kind of poke holes in certain thought loops that might be
Yeah.
erroneous,
Hmm.
that's when they start to kind of the sun starts to shine on them a little, like, okay, this is actually possible. I can actually go back to school. I might just be okay, you know?
Hmm.
And then also anticipating, well, what if something does happen?
Hmm.
If something does happen, is it the end of the world? No. We go to the nurse's office, we lay down for a minute, right? We have a backup plan.
Hmm.
And it doesn't mean that you're a failure. It just means that you have a challenge and we're working through the challenge. And so
Hmm.
to kind of bring it into a space where there's more normalcy there is so meaningful to the patients.
Totally. Yeah, that makes sense. So it sounds like as they get older, you're also bringing in more of the what we call in coaching like thought work, right? And understanding what you're thinking and kind of questioning that and a little bit. Whereas when they're younger, and this makes sense to me having younger kids, is there's only so far you can go with that. And sometimes you just kind of have to help them calm their body down and let the emotions and figure out how to handle the emotions.
Mhm.
But yeah, and it sounds a lot like, I mean, honestly, I think probably any of us adults listening can think of times in our lives, right, where we have to kind of do a little bit of talking to ourselves in that way. But it's a good reminder too that as kids, they don't just naturally come with that ability to sort of talk themselves through some of those
Yeah.
situations, right? Yeah, that's very cool. Um, I forget how we've probably been talking longer than we should. I have so many questions for you. I think the other just if you have anything that you would do differently in this case, I'm curious about, which I know is a big one for those of us with uh, ADHD, is managing anger. And specifically, so my one kid that has both ADHD and autism, we get in this situation where there's really intense flares of anger often around situations which are understandably uncomfortable, right? As we know that, autistic kids and autistic humans just see the world very differently. So you can imagine their reserves are getting depleted all the time. And then if, I think something sets them off, they can have a big anger reaction. And so I'm curious, do you handle it pretty much the same way as anxiety? Are there, have you had experience with kids like that and found anything that seems to particularly help kind of take the edge off of that?
Yeah, I would actually, in these cases, I really convey to my parents that routine is extremely important. I think for patients who are on the autism spectrum, when you stray away from routine, all of a sudden everything feels confusing and scary, and we don't know what's going to happen next. And so being able to stay on a routine as best as possible may help, even if you end up going on a trip, right? Meal times are going to be the same, wake up time is the same, bedtime is the same, right? We take a shower, like, so
Mhm.
as much as you can adhere to a routine, even if there is a change in routine, those are going to help to create feelings of safety around that child. Now, things happen, right? Like life happens, maybe somebody spilled milk on the floor, right? Like, and we want to be able to pull a child away from this catastrophic sort of thinking, like it's the end of the world, somebody's going to slip and fall, I'm going to slip and
Mhm.
fall, or she did it, I didn't do it, stop looking at me, right? Like,
Mhm.
I mean, hopefully this kind of, well, I don't want to say it applies to you, but I mean to say, like, right, like that's the sort of, it's almost
Yeah.
irrational. The anger, the
Yeah.
level of anger is out of proportion to the incident at
Mhm.
hand, right? So when that happens, like being able to pause, like integrating, like almost like a pause
Mhm.
button, Like, okay, something happened. Pause. Let's all take a breath. And the whole family breathes for like, 2 or 3 breaths.
Mm-hmm.
And then we unpause. What are we going to do now? We're going to clean up, and actually kind of talking through what we're going to do to be able to fix the situation. Because again, this is a disruption to what they thought was going to happen next,
Mm-hmm.
right? And then bringing it back. Okay, now after this is done, we're going to go back to doing this.
Mm-hmm.
So I find that really, as best as possible, communicating what's going to happen next helps to prevent these bursts of anger from, you know, getting in that child's way. The
Mm-hmm.
other piece is preparing them ahead of time, like blenders or vacuum cleaners, right? So in our house, I usually tell my kids, I'm like, okay, there's going to be a loud noise. I'm going to turn the blender on. And so even if they don't hear me, I'll very clearly say 1, 2, 3, loud noise, and then I'll hit the blender button. So they
Yeah.
know they
Mm-hmm.
actually brace themselves,
Mm-hmm.
I would say, this is actually true for babies too. Like babies freak out when they hear the vacuum cleaner or the
Mm-hmm.
blender go off. So even for them, they don't speak yet, but they can understand when you do it again and again. You say 1, 2, 3,
Mm-hmm.
loud noise, and you hit the button, right? They know
Mm-hmm.
already that this is going to be the pattern. And as long as you continue that pattern, they're golden.
Mm-hmm.
They're able to brace themselves and then they know it's going to be over and that's just going
Mm-hmm.
to be short and then we're done.
That's
So
such a good example. Yeah.
yeah, I mean, closing car doors, right? Like how
Mm-hmm.
many times do we slam the car door?
Mm-hmm.
Closing the trunk and it's behind them, right? They're
Mm-hmm.
not expecting it.
Mm-hmm.
That would be another example. So, little things that we can integrate in our day to day that we don't even realize that we're doing, these little things can actually make a huge difference in helping to maintain the mental health of our children who have autism.
Hmm. Yeah, those are very relatable examples, and I love. So my son now is 9, and I will say that what you just described is so useful when they're younger, and they can't always tell you what it is. I am amazed by my son over the past like even like 3 or 4 years. He doesn't say it very kindly, but he's now able to tell us much more clearly what the problem is. Like that's too loud, or I didn't, like whatever, right? And he couldn't tell us before. We just saw the outbursts and the confusing behavior. And I think for so many parents of not just kids with autism, but ADHD as well. And I mean, really, this is good advice for any parent. But I think when you have a neurodiverse kid, you it's so dramatic, right? Sometimes, and if you can pause and kind of get past the dramatic behavior and ask like what's triggering it, like what's hard for them, right? And so I love that idea of noticing, okay, maybe it's the loud noises, maybe we can like give them a little bit of a heads up or we can create a pattern around that. But so I love that because I think, and I just share this because I know a lot of the women I work with have kids like this, and I think you can feel so helpless and lost when they're like 4 or 5, 6 years old, just like, why can't you just, you know chill out? And it seems like it doesn't make sense, but it does always make sense, is what I'm learning. It's just you don't necessarily know why it makes sense early on.
Right. Right.
So I feel like those years are hard. And I also, as you were talking, I wanted to point out too, like it's hard work. Like one of the reasons that I wanted to talk to you, Santi, is because you add so much wisdom about the part of what to do about the kids. And I also want to acknowledge that it's just really hard to implement all this stuff on top of being a working mom, right? Like a routine, you want to travel, you want to sleep in, you don't want to have to think about the routine 24/7. And so, first of all, I'm always looking for resources to make that process easier for us. But also, I wanted to point out that you work with kids as well as their parents, right?
Mhm.
So I want to tell us a little bit about sort of the scope of what you're doing in your business to help all of us with these challenges.
Yeah, so I do provide mindset coaching as well as mind body modalities. So that includes mindfulness, meditation, guided imagery, and biofeedback practices to be able to help with the stress reduction component and to be able to help people to honestly break through their own personal glass ceilings. So whether it's the parent going through something, whether it's the parent and the child together going through something, or whether it's a teenager and you're hoping for the teenager to be able to handle something a little bit more independently, I can help all three subsets of clients to be able to, achieve what they're hoping to move towards. Um, you mentioned this thing about guarantees, right? Like in the beginning of our talk, right?
Mhm.
You know, and it's, I wish I could say that there was a guarantee for everything. And I think really part of it is just being able to motivate oneself to want to achieve the goals, right? Like it's not what I provide you. I provide the tools and you can take them and run with them. And that's what I really want is I want to be able to empower you guys to be able to learn about the tools and make them yours so that you can navigate life's obstacles no matter what age, what stage, what situation in life you're in. That's really where the gold is. So
Yeah, I really relate to that. I think it's so cool that you can work with any age because it is so much it's helping the kids with their stuff and working on your, keeping yourself healthy at the same time. And that's exactly the way I feel about a lot of the coaching tools. It's sort of this, once you learn them, you can continue to use them throughout your life. So it's such a lasting benefit. And I just want to say too, like, I love that you're doing this work with kids as well. I have to say, like, I talk a lot about parenting on my podcast, but the best part of parenting for me has been working through these challenges with my kids and like the connections and understanding we have of one another. The connections and understanding we have of one another through that process is so amazing. And I think you're really facilitating that so nicely for families. So well, we've probably talked longer than we should, which is my MO, but and I could probably have you back again. I think I can think of a million more things I'd love to hear. But why don't you share with everyone the best way to find you, reach you for both sort of public content and then if they wanted to work with you?
yeah. So you can reach me at my website. It's iamwellmd.com. So I am as in Mary, WELL. M is in medical, D is in doctor.com. My email address is very similar. iamwellmd@gmail.com. I have a YouTube channel. So if you go onto YouTube and look up I Am Well MD, you'll find me there. And my son also has a YouTube channel that we are developing. So if you look up at Ben's Zen Kids Corner, you'll be able to find that. And I'll provide Jenny with all of the links so that you guys will be able to have them at your fingertips.
Yeah, this was so wonderful. I have taken a bunch of notes here to explore with my family. So thank you for sharing all that valuable content. And I just think this is where I don't know, this is where the real magic happens, I think, in raising our kids. So thank you for what you're doing. And any last words before we sign off here?
I'm just so grateful to be able to share all this with you. I mean, the one thing that I think is has been so true for me is that there's so much wisdom that happens in patient encounters one-on-one. But that's where it stays. It's one-on-one. So being able to share this in a more public way, Jenny, this is so meaningful to me. I just want to thank you for that.
Yeah, of course. I know this is gonna be a great resource for people. And if people, by the way, guys, if you enjoy this, maybe we could do another one. You can send either of us some questions and we could pop on here again. Because I do think you're right. It's nice to take some examples and share the takeaways for everyone. So awesome. Well, have an awesome day and let's talk again soon.
Sounds good. Bye, everybody.
Bye.